This medication, Evomela 50 mg intravenous solution alkylating agents, is used to treat certain types of cancer, such as multiple myeloma and ovarian cancer. It is also used as a pretreatment for people undergoing a stem cell transplant for multiple myeloma. Evomela belongs to a class of drugs known as alkylating agents, which work by slowing or stopping the growth of cancer cells. The daily dosage and optimal timing of Evomela should be determined by a healthcare professional. Before starting the Evomela 50 mg intravenous solution alkylating agents, make sure to read the patient information leaflet from your pharmacist. This medication is administered by a healthcare professional and injected slowly into a vein over 15 to 30 minutes. The dosage and treatment schedule will depend on your medical condition, lab tests, and response to treatment. It is important to receive this medication regularly to get the most benefit from it. It may take several months before you see a benefit from this drug, so make sure to mark your calendar to keep track of when to receive the next dose. If you have any questions, ask your doctor or pharmacist for more information. If you are taking Evomela 50 mg intravenous solution alkylating agents, you may experience some side effects. These can include nausea, vomiting, diarrhea, mouth sores, loss of appetite, and in some cases, severe nausea and vomiting. Your doctor may prescribe medication to help with these symptoms, and eating several small meals and limiting activity may also help. You may also experience pain or sores in your mouth and throat, as well as temporary hair loss. It is important to take care of your mouth by brushing your teeth gently, avoiding mouthwash with alcohol, and eating soft, moist foods. While using this medication, you should be aware of the possibility of serious side effects. However, your doctor has prescribed this drug because they believe the benefit to you outweighs the risk of side effects. It is important to tell your doctor right away if you experience shortness of breath or signs of liver disease. A serious allergic reaction to this drug is rare, but if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you experience any side effects, you can report them to the FDA in the US or Health Canada in Canada. It's important to note that while Evomela 50 mg intravenous solution alkylating agents is used to treat cancer, there is a rare chance it could increase your risk of developing other cancers. Additionally, it may cause a severe decrease in your blood cells, which could lower your ability to fight infections and increase the risk of anemia/bleeding problems. This could make you more susceptible to serious infections or make any existing infection worse. If you notice any unusual growths or lumps, swollen glands, signs of infection, such as a sore throat that doesn't go away, fever, or chills, easy or unusual bruising/bleeding, or unusual tiredness, it's important to contact your doctor right away. In some cases, melphalan could also cause a serious allergic reaction. If you experience rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. Before starting the treatment with Evomela 50 mg intravenous solution alkylating agents, it's important to inform your doctor or pharmacist about any allergies you may have, as well as your medical history, especially if you have bleeding/blood problems, kidney problems, or have undergone radiation treatment. This medication may increase your risk of getting infections or worsen current infections. It's crucial to avoid contact with anyone who has a contagious infection, such as chickenpox, COVID-19, measles, or the flu. Additionally, it is important to inform your healthcare professional before receiving any immunizations or vaccinations, and to avoid contact with individuals who have recently received live vaccines. To reduce the risk of injury, it's important to use caution with sharp objects and avoid activities that may lead to cuts or bruises. Before undergoing any surgical procedures, it's important to inform your doctor or dentist about all the medications and herbal products you are using. This medication can affect fertility in both males and females, so it's important to discuss this with your doctor. If you are pregnant or planning to become pregnant, it's crucial to inform your doctor, as this medication may harm an unborn baby. For women using this medication, reliable forms of birth control should be discussed during treatment and for a period of time after the last dose. For men using this medication, the use of reliable forms of birth control should also be discussed during treatment and for a period of time after the last dose. If pregnancy occurs, it's important to consult your doctor immediately about the risks and benefits of this medication. It is not known whether this drug passes into breast milk, so breastfeeding is not recommended while using this medication and for a week after the last dose. It's important to consult your doctor before breastfeeding. When taking Evomela 50 mg intravenous solution alkylating agents, it's important to be aware of potential drug interactions. Mixing certain medications can impact how they work and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products. Share this list with your doctor and pharmacist to ensure safe usage. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Also, be mindful that melphalan is very similar to melphalan flufenamide. Avoid using medications containing melphalan flufenamide while using melphalan to prevent any adverse effects. Always follow your doctor's guidance and instructions when taking Evomela 50 mg intravenous solution alkylating agents. If someone has taken too much Evomela and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. Now, it's important to note that while using Evomela 50 mg intravenous solution alkylating agents, you will need to undergo regular lab and medical tests, such as a complete blood count and liver function tests. It's crucial to keep all your medical and lab appointments to monitor your health and the effectiveness of the medication. Make sure to take each dose of Evomela 50 mg intravenous solution alkylating agents as prescribed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. This medication is administered in a medical facility and is not meant to be kept at home. It is important to follow the instructions of the healthcare professional for the proper administration and usage of Evomela 50 mg intravenous solution alkylating agents. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.